So this is a video on how to treat your phobia of blood withdrawal, so a blood test using gradual exposure therapy. So this is part of the blood injection injury phobia, and this is basically an irrational fear of anything to do with, you guessed it, blood injections or injury, including medical procedures. So this is really serious because it affects 3 to 4% of the general population, and these people won't go to hospitals, won't go to doctors, or put themselves in a position where they'll be exposed to any of this. Or on top of that, they won't donate blood that could potentially save hundreds of lives. So my name's Shenley, and I'm currently studying psychology at the University of New England. And I'm going to talk to you about using behavior modification techniques to overcome this phobia. So behavior modification analyzes and changes behavior, and there's been a lot of studies that have proven it to be successful in changing behavior, and that includes phobias. So the first thing you need to do is conduct an assessment, and in this case, that's on yourself. So you can type up a number of questions, and they're all going to focus on your phobia. So how do you feel beforehand? How do you feel during? How do you feel after getting a blood test? How did you feel the last time you got one? How long ago was your last one? And is there a reason why you have this phobia now? So once you've created this assessment, once you've done this assessment, the next thing you need to do is to create a fear hierarchy. So this will involve ranking 15 to 20 items, starting at the very bottom using a subjective units of distress scale, otherwise known as SUDS. And this uses a 0 to 100. So 0 is you're feeling calm, happy, it's not bothering you. 100 is catastrophic. So the worst thing that you can ever think of, anxiety ridden. And in this case, it's going to be your blood test. So you start from the bottom, and you want to think of things that gradually go up. So you'll start at 0, and you don't want anything above 10 points. So if you start at the bottom, and that might be reading a pamphlet about getting a blood test or donating blood, and the next level up may be talking to someone, but you don't want more than 10 points in between because it needs to be gradual. And your catastrophic one needs to be rated between 95 and 100. And this forms your baseline for treatment. So this is where you started. This will hopefully be the most fear that you will have. Another thing to consider is, do you faint, or do you feel faint, or have you fainted when getting a blood test before? This is important because if you do before you start working your way through the hierarchy, you need to start practicing applied muscle tension techniques. So ideally, you would practice this for about a week, and you would get your hands on a blood pressure machine. So when you faint, when you feel anxious, it raises your blood pressure, and when you go to get your blood test, your blood pressure drops. And this is what causes you to feel faint or faint. So if you can measure it while you're practicing it to try and keep it steady, that would be great. But if not, just do the best you can. And then when you feel like you have got it under control, then you can move on to go through your fear hierarchy. So you start from the bottom of your fear hierarchy. So the thing that you start at 0. So that might be reading a pamphlet. So if you already start at 0, then you can move on to the next thing. And that might be a level 10 on your SUD scale. And then once that drops to a 0, then you can move on to the next until you feel ready to move on to the next step. And you keep going through each trial of an exposure until you reach your catastrophic level, which is the blood test. So while you're doing this, after each exposure, so when you start, you need to set up a table and record your level. So you started at 0 and then you move on to the next one, which may have been rated at 10. So you rate it how many times it takes for you to get down. So just record all your results every exposure you do. This is really important for assessment, and it will also work as a reinforcement because you can see that you're improving. And once you keep moving through your hierarchy, it would be good to call your family, tell your partner when you've moved on to a next one, and they will be genuinely happy and will praise you because they know how this has affected your life. And that praise will act as a reinforcer to motivate you to continue. So once you've moved through the hierarchy and you reach your fear, your catastrophic state being getting a blood test, when you're getting it done, you can bring a friend, anything that will get you to get that blood test, and get them to take a photo of you getting it done. This is really important because it will help you in maintaining and give you the motivation, and you can look back on and reflect that you got this far and that you've done it and that there was no bad consequences afterwards. Well, we hope so. So once you've reached this stage, your SUDS level should be down, but the most important thing from here is to maintain this. So you need to regularly go for checkups. You can look at your photo that you got while you were getting the blood test, or you could even make another goal to be a regular blood donor, which you'll be saving a lot of lives. So everything that I've spoken about, the fear hierarchy, the assessment, the fear hierarchy, the reinforcement, and the maintenance, these principles can be applied to a number of phobias. But hopefully this will get you through getting over your phobia of getting a blood test. So give it a go.